Type 1 diabetes affects 1.9 million Americans of all ages. And though there is testing available, the Diabetes Leadership Council reports that 2/3 of parents are unaware that T1D can be detected before symptoms occur. Here this morning to share more about screening and early detection is a University of Florida professor and medical director, Dr. Desmond Schatz, and Dr. Anastasia Albanese-O'Neill with JDRF International. Good morning to you both.
Good morning.
Good morning.
So I'd love to start with understanding the difference between type 1 and type 2 diabetes. What should people be watching out for?
Thanks so much for that question. So there are nearly 40 million Americans living with diabetes and about 96 million more at risk for type 2 diabetes. Type 1 diabetes is the less common form. It affects about 2 million Americans and about 9 million people worldwide. Here's the difference. In type 1 diabetes, we see the body's immune system attack and destroy the insulin-producing cells in the body. It means that the person is unable to produce insulin. Insulin helps us keep our blood sugar levels in the target range. So if you can't produce insulin, blood sugar levels become very, very high. So people with type 1 diabetes absolutely have to replace insulin by injection or using an insulin pump. When blood sugar levels get high, there's a number of symptoms we see. Increased thirst. People are drinking all kinds of water or other beverages because they feel thirsty all the time. Increased urination, frequent trips to the bathroom, and some people even wet the bed at night unexpectedly. Weight loss, and sometimes blurred vision. If you have any of these symptoms, you need to check in with your doctor. This is a late indication of a type 1 diabetes diagnosis. Let's talk about type 2. It comes about more slowly, and it's about insulin resistance. People can produce insulin, but their body can't use it well, and so we also see high blood sugar levels, but for a different reason. People with type 1 diabetes can manage this in a number of different ways and actually get those blood sugars back to target. They can do it by changing their lifestyle, increasing exercise or changing their diet, and there are a lot of options in terms of pill they can take or other medications. Again, with type 1 diabetes, you've got to take insulin by injection to keep those blood sugar levels in the target range.
Now, who specifically is at risk for type 1 diabetes?
I want to just qualify that by saying that we know that screening programs exist for type 2 diabetes. And if we think about, as Dr. Albanese-O'Neill has said, there are 37 million people with diabetes. Actually, 5 or 6 million don't even know that they have it. And so clearly screening has been indicated for type 2 diabetes for several years. But it's only very recent that type 1 diabetes screening really has come to the fore. It's always been part of research studies such as the Diabetes Prevention Trial, TrialNet, where we screen relatives of people who have type 1 diabetes. So the people who really need to be screened are those family members who have a family history of type 1 diabetes. And again, the reason for the family history is that 1 in 20 relatives will develop type 1 diabetes. And by doing a simple blood test, as Dr. Albanese-O'Neill has said, that it's an autoimmune condition in which the own body's white blood cells are being destroyed, we can detect that process by a simple blood test, by drawing a bit of blood and by assaying, in other words, measuring the blood for the appearance of these antibodies called islet autoantibodies. We can, in fact, identify those family members, those 1 in 20 people, will subsequently go on to develop the disease.
Now, what should someone do if they've tested positive?
So if you test positive, it's really important to take next steps. And there are several things that you can do. One is you need to immediately speak with your doctor about learning about the signs and symptoms that we talked about, increased thirst, et cetera, so we can prevent hospitalization at diagnosis. At JDRF, we've funded $2.5 billion in research. What we've learned from some of those studies is that we can reduce the risk of hospitalization at a type 1 diabetes diagnosis all the way down to less than 5%, but we need to know in advance if you're at risk, and that happens through screening. So one real benefit is reducing a really almost life-threatening experience at diagnosis. That's number one. Number two, related, it gives you or the parents of a child time to prepare and think about how they're going to manage this need to engage in insulin therapy, insulin replacement. And then finally, I think perhaps most important or equally important is that people can think about engaging in research that helps us figure out how we can delay, prevent, and ultimately cure type 1 diabetes. So a generation from now, we're not having this conversation.
Well, thank you both so much for joining us this morning. For more information, be sure to visit gettingaheadoftype1.org.